السلام عليكم، نرحب بكم في أول حلقة من حلقات برنامجنا برنامج UQUDent. وزي ما وعدناكم معانا أول ضيفة في برنامجنا دكتورة وعد خياط، قسم الحشوات التجميلية للأسنان. السلام عليكم دكتورة.
وعليكم السلام ورحمة الله. الحمد لله بخير، كيف حالك؟
الحمد لله. وصلتنا عدد من الأسئلة وحنبدأ نسألك هي ونتمنى منك إنك تجاوبي لنا عليها.
إن شاء الله بإذن الله، ويسعدني إني أكون معكم اليوم إن شاء الله.
إن شاء الله. طيب أول سؤال عندنا how we can prevent the discoloration of the aesthetic restoration, especially resin composite, or how we can make it more durable?
Okay, let me before answering this question to talk about a little bit about the mechanism by which the discoloration of composite restoration occur. In fact, the discoloration of composite material occurs usually either internally because of the oxidation of some of the composition of the composite resin material, such as the amine compound, which is added to the composite material as an accelerator, or if there is any free and reacted monomer because of incomplete polymerization, then what's going to happen that this unreacted monomer will react with the other molecule and cause internal discoloration, and this usually happens over the time. Also, as we know that dental restorations is continuously exposed to the aqueous nature of all environment, fluid, saliva, and water, and because of the susceptibility of water absorption of composite material, then water molecule will attack the resin matrix of the composite, and that will cause hydrolysis and formation of some micro cracks and gaps within the bulk of the material. When there is like external staining from food, beverages such as tea, coffee, or from the nicotine, with the presence of these defects within the material, these defects will act as an area of accumulation of the staining, leading to the discoloration. Especially if the surface is rough, then more of the stain will be retained on the surface for a longer time. Also, if there is a discoloration within the margin, that means like micro leakage, because of the micro leakage, because of improper bonding of the restoration or deterioration of the hybrid layer over the time, these are all factors that will cause the discoloration. So let's go to the other main part of our question, how to prevent them. We cannot prevent them completely, but at least we can control them. Here are some few tips. First of all, always place your composite restoration under complete isolation using the rubber dam, because that will ensure that you have a dry field. So you will protect your newly placed restoration from water absorption and ensure that you have proper bonding. The second thing that you can do, always follow the manufacturer instruction regarding the adequate time of curing of your composite, particularly for each brand, because you want to make sure that there is complete polymerization. Polish your restoration very well, and I recommend to do like periodic polishing of your restoration every few months just to enhance the durability. Make sure to bevel your margin to prevent the marginal discoloration. Use in aesthetic zone microfilled composite material because it has high wear resistance and high polished surface. In high aesthetic cases, use the ceramic restoration because it has higher color stability. And the final thing, educate your patient about what factors that may stain or discolor the restoration in the oral cavity.
The second question, in case of application different shades in the labial surface of the teeth, example cervical third A3 and incisor third shade A2, how we can prevent the line of demarcation between the different shades?
So in order to create like natural looking restoration, we have first to understand the concept of the color of the natural tooth structure. As we all know, tooth structure is composed of inner layer of dentine, which is opaque and yellow, and outer layer of translucent enamel. And mainly the color of the tooth structure comes from the underlying dentine, and that depends on the thickness of overlying enamel. So in the cervical area, when the enamel is thin, that reflects the underlying color of dentine. So from this idea or concept, the dental companies come up with the aesthetic composite, which has dentine composite and enamel composite. And the basic difference simply is the translucency levels and the opacity level. They're playing that with the type of and size of fillers and some additives. So when you start building up your restoration, start the inner layer with dentine composite. Customize the shade at each area, the cervical, the middle, the incisal third, and then cover your restoration with a layer of enamel composite. So it's gonna reflect the underneath color. It's gonna be a little bit translucent, so it's gonna reflect the color of the dentine composite underneath without showing any demarcation line. But let's assume that you don't have this fancy type of composite restorative material and just you want to use whatever basic standard shade that we have in the clinic to create like a multi-shade restoration. In this case, my advice to you is to overlap your layers. For example, if you want to use multiple shade, start with the darker shade at the cervical area, make your layer thinning toward the middle area of the tooth, and after that, place the other shade like with overlapping a little bit the previous layer, and this way you will not have like a clear mark line between the two layers. You will have an area of gradual transition, and that will help to get a better aesthetic restoration.
Okay. Next question. To obtain glossy and smoothie surface of the restoration, in your opinion, what's the best technique or instrument that used in finishing and polishing?
Just to simplify answering this question, let me talk about the finishing and polishing procedures in steps, and each step I will mention which instruments or tools that can be used properly for each step. The first step is the finishing procedure, where you just finalize the shape of your restoration, create some anatomical details and the texture of the restoration. Always follow the manufacturer instruction for any type of finishing and polishing kit that you are using. They all have finishing and polishing burr that should be used in the right sequence. Follow their manufacturer instruction regarding the direction of the using the burrs, either like circular motion or unidirectional or like scrubbing action. For the finishing procedure, I prefer using the thin tapered fine diamond burr to create to modify the line angles and create some surface texture. I also use the football fine diamond burr, or sometimes you can use also the white stone just to create the palatal contour and the anatomical detail of the occlusal surface of posterior restoration. I use the Soflex, the medium grit, we call it abrasive disc, to modify or adjust the embrasure of your restoration and the flattened contoured surfaces of anterior and posterior restorations. The next step is to give your restoration a smooth surface, but before that also I prefer to finish the interproximal part with using a finishing strip, medium grit or fine grit, depend on how much adjustment you need to do in the interproximal area. The second step is giving your restoration a smooth surface by using rubber cups or rubber points on the occlusal surface and rubber discs on the flat and contoured surfaces of your restoration. But remember not to over polish your restoration, otherwise you will lose the details that you created and the texture that you created during the finishing procedure. And the final step is to give your restoration the glossy appearance or the high shine appearance by using polishing paste, either diamond or aluminum oxide paste with soft brush and or wheel. And it's important to use a soft brush, not a hard one when you are doing your final polish.
What is your golden rule or tip or advice to obtain perfect aesthetic restoration?
Well, it's hard to come up with one golden rule, but generally here are some few guidelines or principles that you can apply to manage any case of aesthetic dentistry. First of all, you have to know that the patient satisfaction is one of the major components of the equation of the aesthetic dentistry. So that's why you need always to get as much details as possible about the chief complaint of the patient. ask more specific questions, know what the patient likes or doesn't like about the restoration or about their teeth. Is it the form or the shape, the color, the size, or the alignment? Because sometimes, no matter how perfect is your aesthetic work, if you don't address the chief complaint of the patient, he will not be satisfied. And sometimes it's just a very minor thing that you adjusted to the patient that was really bothering the patient, and that will make all the difference. Another rule in aesthetic dentistry, like in aesthetic dentistry, the very minor or small details of your work is what creates the major and most significant aesthetic outcome. So always train your mind to be details oriented. Focus on the details of your work, but without losing the overall picture of the aesthetic, like the facial picture of the aesthetic. Also train your eyes to see the commonly unseen things, like the line angles in 3 dimensions, the light reflection, the details of the macro texture of the teeth structure, and also like to see the depth of the color of the restoration. These tiny things what makes your work unique and standing out than other work in aesthetic dentistry.
Okay. Another question. How to make completely sure there are no high spot in restoration besides using the articulating paper?
Okay, for sure using the articulating paper is a reliable and accurate method to locate exactly the high spots that need to be adjusted. In addition to that, you can use the shim stock paper just to check the occlusion. It's a very thin and soft foil made mostly of metal that you can use it to check the occlusion of teeth individually. This is one of the way. Some dentists may use the sound of tapping of teeth as an indication besides the other methods, but you have to be trained on that to compare the sound of the tapping when there is a premature contact than when there is an optimal occlusion. Also, we can ask the patient, but remember, don't rely only on this method, because it's usually hard for the patient to detect the high spot of in their occlusion, especially when they have their jaws opened or stretched for a prolonged time under the effect of the anesthesia. Exactly. Yeah. But here is some few tips that how to use the articulating paper like properly, so you get the accurate high spot that you can adjust it. Always keep your patient in the upright position when you check the occlusion, and always like check the occlusion pre-operatively and post-operatively, so you can have always reference how the occlusion was look like before you do your restoration, and also just to know where are the original contact points, so avoid placing the cavity margin on these points. Check the occlusion on both sides, the side that you deliver the restoration and the other side. Check the eccentric and centric occlusion using different color-coded articulating paper, and adjust according if this is a functional cusp or non-functional cusp, if this is a balanced side or working side.
Yeah, I think also the drying the cavity very well will promote.
Of course, yeah. Always make sure that you dry the teeth surface before placing the articulating paper, and also you can apply a thin layer of Vaseline on the articulating paper. That will help mark the spots very clearly.
Okay. What's the best way to have a perfectly natural looking composite restoration, considering the anatomy, shade selection, and instrument used?
Well, this is a very nice question, but this type of question is what a whole book in aesthetic dentistry would talk about. To answer it, it's a very broad question and hard, like just to summarize everything in one answer. But I feel that I already gave the answer to this question by answering the previous questions. One more thing that I may add here is in aesthetic dentistry, just to get the perfect restoration, focus on the knowledge about dental anatomy, knowledge about aesthetic analysis, the materials advancements and updates. Refine your skills to use the proper techniques for each material, because all materials have limitations. but no matter how perfect is your material, no material can withstand any handling errors.
Okay. Our last question. إيش أفضل النوع من الفينير؟
في طبعا عندنا عدة أنواع مختلفة من الفينير، أغلبها مصنوعة من مادة السيراميك، بس أنواع مختلفة من السيراميك. يعتمد طبعا كل نوع بنستخدمه حسب الحالة. عادة الفينير اللي مصنوع من مادة البورسلين بيكون من الناحية الجمالية بيعطي أفضل نتائج، لكن من ناحية المواصفات الميكانيكية بيكون أقل من بعض أنواع السيراميك المختلفة.
شكرا لك دكتورة على وقتك اللي أعطيتينا، هو مرة انبسطنا معك، يعطيك ألف عافية.
شكرا لك ويعطيكم ألف عافية يا رب، وشكرا لكل فريق العمل في UQUDent. أتمنى تكونوا فعلا استفدتوا من الحلقة، وشكرا لاستضافتكم لي.
وبكده وصلنا لختام حلقتنا الأولى من برنامج UQUDent. نتمنى أنكم تكونوا استفدتوا